Good morning. I'm Crystal. Nice to meet you. I'm Dr. Stevenson's nurse, and I'll be assisting you today with your procedure. How are you? Okay. Are you a little nervous about the procedure? Okay. Well, that's normal. And that's why I'm here, so that I can explain a little bit more about it to you. Okay. So as we both know, you're here for Mohs surgery, and it's being performed by Dr. Stevenson, and I will be assisting her today for your procedure. So I'm just going to explain a little bit about the procedure. So again, the procedure is called Mohs surgery. And Mohs surgery is considered to be one of the most effective treatments for non-melanoma skin cancer, which is why you're here. Some forms of that type of skin cancer is the basal cell carcinoma or the squamous cell carcinoma. In your case, it's the basal cell carcinoma, or what a lot of the medical professionals refer to as BCC. The basal cell carcinoma, it's located on the top layer of the skin, which is also known as the epidermis. So, as far as the procedure, after we get you prepped today, prepped and ready for Dr. Stevenson, I'm just going to explain to you a little bit about what's going to happen during the procedure. So the first thing she's going to do is she's going to draw an area, or she's going to take a marker and draw around the lesion that's on the face, just to kind of give her a guide, um, to remove that lesion there. And then after that, she's going to inject you with a local anesthetic to deaden the area. And then she's going to take a scalpel and remove the thinnest visible layer of that tissue. Then she's going to take that to the lab, which is on site. Dr. Stevenson is a pathologist as well as a surgeon. So she will be performing all of this by herself. A pathologist is just a physician that she's trained in the study of disease. So she's going to take that thin layer that she has removed and put it under a microscope. Excuse me. Take that specimen and put it under a microscope so that she can examine it and kind of see if she needs to uh, remove any more of the cancerous tissue. Does that make sense? So while she's performing that, I'm going to dress your area, bandage it up, and I'm going to take you to the waiting area because this part of the procedure is so meticulous and she has to be so precise that it takes a lot of time. So it could take up to about several hours for her to, just take a thin layer, um, take it to the lab, uh, examine it, and then if she has to come back to remove more of that tissue, that does, take time. So then, if she does have to say come back and to come back and remove more tissue, she'll start the process over. So she will give you more anesthesia. So don't be, worried about that because it could wear off because of the time frame from the first round is what it's called. The anesthesia can wear off. So she's going to reapply the anesthetic to deaden the area, and then she's going to remove another layer, and it's going to continue until after she examines that specimen, each specimen under the microscope, there is no more cancerous tissue. Now, after all of the cancerous tissue has been removed and you're cleared for the cleared of all of the cancerous tissue, like I stated, then what will happen is she will either stitch up the area. That's if stitches are appropriate. So if after she removes the cancerous tissue, if she can stitch that area up, you'll get stitches. But if not, and it's very rare, but in some instances, the wound is too large for stitches, so therefore, she may have to perform a skin graft just to, cover that area up. So she'll take, skin from another part of your body to replace what's been removed that was cancerous, and then she will bandage it up so that it can heal. But that's not, that's very rare. But that is something that you need to be aware of if that is the case, if the wound is that large. Now, after we bandage you up, we will give you instructions, discharge instructions, so that you can care for the incision, and types of medication, over-the-counter medications you may take, in case you experience some pain. It's very important that you get a lot of rest. I hope that you've taken the day off or the next couple of days, so that you can heal properly. After that, then Dr. Stevenson, we have to schedule what's called a post-operative follow-up visit, and she likes for her patients to come back a week after the procedure. So today is October the 11th, so she would like to see you back on October the 18th. Now we have morning, afternoon, and evening appointments. The earliest I have, let me check my tablet here. Let's see. The earliest I have is October the 18th, starting at, let's see, 9 a.m. And she has appointments all the way up until 4:30 p.m. So what's a good time for you so that I can, pencil you in? 10:30? Okay. So I'll put you here. All right. Okay, so I have you scheduled 10:30 a.m. That's next Wednesday, um, on October the 18th for your follow-up visit. And at that visit, she's going to remove the stitches, and then also assess the area and make sure that it's healing properly. Um, let's see. If you don't have any questions, um, what I'm going to do, I have your gown here, so that you can get dressed, we can get you prepped. So what I'm going to do is give you some privacy, so you can get dressed. And like I said, I'll be back to get you so that we can take you over to the other room, which is where she performs these procedures. So I'll give you maybe about 10 to 15 minutes to get dressed. Is that okay? All right, and you sure you don't have any questions for me? All right. Well, I will leave you to it. If you think of anything else, just let me know. Okay.